it doesn't seem that healthcare is something you need to market, but you take away the name marketing. So maybe marketing is a wrong way to think about it. You call it communication, engagement, awareness, humbling yourself, going to the customer and saying, okay, there are a series of attributes you value. I want to understand what they are. I want to craft a campaign around that. And I will tell you, these are the good things about what we provide, and this is the solution that we're able to offer.
So something like a medical service or anything related to healthcare is difficult to market or advertise for or do branding for. So one, is that a concern, or do you just care about the service and you hope that that will speak for itself, or what are the regulatory issues? How do you work around it?
The role of marketing in healthcare. It doesn't seem that healthcare is something you need to market, and marketing does tend to have a very sordid reputation. Okay, marketing is tobacco, gutka, soft drinks. These are things that you don't need in life, so I need to force feed you half naked models so that I can pitch you on this thing that you don't need in life, but this is what you have. Whereas healthcare is lofty, it's aspiration, it's something that is good for you, so I don't need to tell the whole world I'm so great. You don't need to market that. And that is the old school reputation that our company had, and most healthcare companies had as well. But you take away the name marketing. So maybe marketing is a wrong way to think about it. You call it communication, engagement, awareness. Functionally the same. It is the conveyance of timely, useful information to educate your customer that I am a provider of services that will make your life better. And we saw consistently that while we have great word of mouth, we have an incredible reputation, people really respect us, that we were losing relevance in the marketplace because we underinvested in the brand, we underinvested in marketing, we didn't spend any amount of time telling people how good we were. And so what happened is that vacuum got taken up by, on one end of the spectrum, absolute pretenders, on the other end of the spectrum, by new entrants. So what are the pretenders to healthcare? That is people who come online who say that, wake up every morning and look directly at the sun and you will not get cancer. Or if you mix all these different kind of concoctions in water, then it will cure all your heart disease. Or if you breathe really quickly through your nose, the COVID will just go away.
That's not true.
I mean, yes, that last one is true. Absolutely. If you breathe really hard enough for your lungs to fall out of your nose, then yes, the COVID will go away.
Got it. I'll
Yeah.
try it.
Yes. That is an example of excellent marketing because it was witty, it was catchy, it's viral. It, with minimal effort, whoever came up with that nonsense and, supported with, so-called ancient texts, right, which say that it probably doesn't, but they're able to create this entire industry around misinformation, conveyed in a very accurate way. And so they're able to sell their services and pretend to the customer that they're solving a problem. So maybe failure as a solution, but great success as marketing. Or if you look at new entrants that are much better attuned to what customers value and want. There are a lot of startups that have entered into the surgery space that have come in as single specialty chains as well, who do way better job at communicating to the customer exactly the attributes that customer values higher than we do. As a hospital group, what we value? Clinical outcomes, skill of the doctor, all the certification and compliances that we need to take care of, and providing the best equipment and the best medicines and so on. Patient doesn't see any of that. They're anesthetized, they're unconscious while most of that is happening. What do they value? Quick in and out time, convenience, easy booking, someone to pick up and drop. Someone followed up after you went back home and said, hi, how are you feeling? Did the surgery go okay? That is what the patient value because they're conscious and they're aware. So their perception of what healthcare services have to look like was drastically different than what we thought. And so we realized, okay, we are failing completely in this game. We're failing at telling the customer exactly what it is that they value most. And we're parroting on and on about things that, we show cross-section of the human organ. No one should have to look at what a human organ looks unless you're in medicine. It is gruesome. In fact, a lot of the time in Facebook, we get a lot of our ads taken down because they say this is gore. Because the AI identifies a lot of the material we put down as gory material, like horror story stuff. So we've had to learn a lot. We had to recalibrate a lot. We had to take an example from a lot of startups. We had to go a lot more, become a lot more humble, go down to the customer's level and ask, okay, now what do you value most about us? What are the things you appreciate? And so that simple act of humbling yourself, going to the customer and saying, okay, there are a series of attributes you value. I want to understand what they are. And I want to craft a campaign around that. And I will tell you these are the good things about what we provide, and this is the solution that we're able to offer. So that is marketing done much better. And that is how you develop a non sordid reputation around doing marketing in healthcare.
Awesome. Friends, if you like this clip, then please go watch the entire episode and also subscribe to the channel for more such clips and episodes. Enjoy your life. Thank you very much.